Okay, just to go over some timing intervals, because when you're assessing a pacemaker function for one of your clients, you're going to have to understand what the timing intervals signify for you. Now, so the first thing you want to do is have a look at these rhythms that I have drawn here. Here is what we call a ventricular paced rhythm. Or we call it VP, or you can call it, label it VP. So you have a pacemaker artifact followed by a wide QRS complex, and then a little bit more time goes, you have another pacemaker artifact, and then another QRS complex, and so on and so forth. The one thing I want to draw your attention to is the distance between here, the two spikes. Okay? That distance is called the automatic interval. And this is a pre-programmed timing interval that tells the pacemaker exactly, and this is when we're talking about synchronous therapy. So we're asking the pacemaker to watch and sense, look for any intrinsic activity, and if you don't see any, then you'll fire. And so this is the time at which the pacemaker will be searching for intrinsic activity, or the patient's own intrinsic activity. And then if it doesn't sense any activity, it will fire again. But what is interesting, what you should notice about the automatic interval, is that it is also the same distance. It would be the same distance from, in this way, I guess I'm drawing a Q to Q, but an RR wave. Okay, so when you think automatic interval, I want you to consider for a second the RR interval in normal, in the normal sinus rhythm, and consider that when we're looking at analyzing pacemaker, it's important to look at the automatic interval, because that's going to tell you if the function of the pacemaker is correct. Because if anything comes early, or if anything comes late, or if something is missing, those are dysfunctions of the pacemaker, and you would have to identify. So the automatic interval is a key thing to remember. Similarly, if we have an atrial paced rhythm, which is this one, atrial paced rhythm, or atrial paced. You see you have the pacemaker artifact followed immediately by the P wave, then the QRS complex. In this situation, I haven't purposely drawn that to be wide. It's just because I don't have graph paper and I'm not drawing properly. So we'll say a normal narrow complex, because we'll assume conduction is intact. Atrioventricular conduction is intact, and then your T wave. And again, you'll have a spike, capture, spike, capture, spike, capture in the atrium. Okay, but again, the distance between here and here is your automatic interval. So that's an automatic interval for the atrial paced rhythm. From there to there is the automatic interval for the ventricular paced rhythm. Okay, and the other thing you want to understand is the whether or not, so the this synchronous pacing. So the automatic interval looks like this. The pacemaker will fire, capture the ventricle. So this is a ventricular paced rhythm here, this example here. It will capture. And then the automatic interval, as soon as it fires the automatic interval, it starts counting, and it's looking, and it's looking. It doesn't see intrinsic activity. Then it fires, captures the ventricle, but the counter restarts, and it's looking, and it's looking, and it's looking. It sees nothing, so it fires, captures the ventricle, and it starts to look. Again, timer resets, and it starts to look, look, look. And then this should represent an intrinsic ventricular activity. Okay, so that's a normal, imagine, of course it doesn't look like that, but a normal narrow QRS complex. And when it fires, the pacemaker is set to, again, I didn't have to fire because I sensed intrinsic activity, so I'll inhibit. I'm not going to fire, but I'm going to reset my timer, and I'm going to start looking and looking and looking. And the next time it fires should be at the similar automatic interval. So I'm assuming that this measures the same as this, measures the same as this, okay? So when I see intrinsic activity, I reset my automatic interval, and I start looking again And if I don't see anything, then I fire. So this is a normal pacemaker function. So you'd have, a ventricular paced rhythm with one intrinsic beat in this sample or example that's here. Okay, there's two other timing intervals that I want to discuss with you. And the textbook that you're reading, when they look at analysis of pacemaker, they're strictly looking at ventricular paced rhythms. And knowing what you know as you're moving through the unit, there are possibilities to have dual chamber, even triple chamber pacing function in the heart with the newer technology. So I just want to talk a little bit about some of the other timing intervals. So let's see if I can draw here. P wave, QRS complex, P wave, QRS complex, P wave, QRS complex, P wave, and so forth. Okay, I'm going to draw in some pacer spikes here. So that's the atrial lead firing. So I'm assuming assume a dual chamber pacemaker here. So the atrial lead fires and captures. Then the ventricle lead will fire and capture because that's wide. Assume that's wide. And then again, it'll fire and capture the atrium. And then again, fire and capture the ventricle. I'll make that a little bit flatter so that it doesn't confuse anybody. I don't want to put an extra deflection in there to create problems. And then again, I fire. And then you see something different here. This is a normal narrow complex. I don't have another spike. That's an intrinsic complex. Then I see a P wave. And then I have a pacer spike. So let me explain what's happening here. Okay, so because you're seeing multiple spikes here around one complex, this is how you're going to know that you're dealing with a dual chamber pacemaker with a lead in the atrium and a lead in the ventricle. Okay, now we have the pacer artifact in the atrium. It fires and you capture and you have a P wave. Then the distance, the timer starts here. This timer, pacemakers is called the AV delay. This is a timing interval that is meant to mimic the normal AV delay in normal sinus rhythm, because remember, we want to take advantage of atrial kick and the benefits for ventricular filling and the stroke volume. Okay, so we want atrial depolarization then contraction prior to ventricular depolarization and contraction. So this one is called the AV delay or the AV timing interval, which is the distance here. Okay, so once the atrium fires, the pacemaker fires for the atrium, it starts to count. The timing interval starts to go and it's looking. If it doesn't see ventricular activity, intrinsic ventricular activity, it's set to fire. Good, it captures the ventricle. Now, between the ventricle, this ventricular pacing spike, and the next atrial pacing spike, which is this guy here, that one is called the ventriculo atrial timing interval. Not totally dissimilar to the automatic interval, but specifically it is the time or the timer that's set, pre-programmed between ventricular pacing and then the next atrial pace. Okay, so we'll just go like this and then we'll go like that, just so you know. Okay, so this is the AV delay between the ventricle and the next atrial, between the ventricular artifact and the next atrial artifact. That's the ventricular atrial timing interval. And then you can also see that there's actually an automatic interval for the atrium and also an automatic interval for the ventricle. Okay, so we still have the automatic intervals. All right, so let's move on here. So this was the second complex. We had atrial paced and then ventricular paced. And the timing interval starts counting. The ventricular atrial timing interval counts. And it's looking for something. Nothing happens, so it fires. And we capture the atrium, get a P wave. Then the AV delay timing interval, the AV timing interval starts, and it's looking for intrinsic activity. And it's looking, and what you see here is to represent an intrinsic QRS complex. So it does not fire, right? So this is actually atrial paced, but this is ventricular sensed. Okay? And then again, your pacemaker starts counting. The ventricular atrial timing interval starts counting, and it's looking for intrinsic activity. I don't know if it's coming across in the video, but there's a little P wave here. Okay, and notice that there's no pacer, red pacer artifact before it. And look, if you look, I've tried to purposely draw that it happens here, and it's a shorter time than the distance between the last cycles, so the second and the third ventricular atrial timing interval. So here it starts again, but then we have a P wave. So it senses that activity in the P wave, and then it triggers this AV delay to start counting. So it's looking for ventricular activity. It doesn't see any, and so it fires. Okay, and then we have a wide QRS complex or ventricular paced. So here we have atrial sensed, but then we have V paced. Okay, so hopefully that helps a little bit.